Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is when Lyme disease comes back, and secondarily, treating Lyme disease without antibiotics. And the reason I would like to share today is because I saw 3 different patients today that this is relevant for. And one of the things that we've been able to do over the last couple of years is to initiate a natural Lyme disease treatment program that does not require antibiotics. And now we have enough history with it that we know that it works most of the time. We can't say that it works 100% of the time, but most of the time it seems to work. And so I'd like to share the different nuances that these 3 patients had that represented part of their recurrence. The first patient experienced one of the key parts of the natural program, which assumes that we get Lyme disease because we have somehow messed up our immune system, largely through the lifestyle changes that have been part of our experience since about the 1980s. And we consume a lot of chemicals, particularly a chemical called glyphosate, which is an herbicide that disables our immune system and there are other things that happen that basically changes the Lyme organism from what it used to be, which is something that used to live in people without causing disease, to something that now is an opportunistic infection in people whose immune system is not in the right place. And so part of the natural program that we've created is to get the junk out of the body that is contributing to the situation where the Lyme organism is becoming opportunistic and causing damage. And we know that the Lyme organism has been in humans for hundreds and thousands of years because we can see evidence of its DNA signature in human remains that are hundreds and thousands of years old. So it's not new that it's in our body. What's new is the damage that it's causing, especially since the 1980s, when it's started to explode as a problem. And so this particular patient discovered that he had started to change some of the things that were the main sources of toxins getting into his body that were causing this very problem. And while he was doing some of the other part of the program correctly, he wasn't doing this part correctly. He wasn't holding back the toxins that are critical to messing up the body. But he started to make the change, and then he went and had a meal that was part of a family celebration. And just that one meal with the foods that are part of our no-no list precipitated his symptoms coming back. And we reflected on that together, that this particular chemical was in these particular foods, and that was coincidental with the symptoms worsening. And for some people, they are exquisitely sensitive to these chemicals. Other people can kind of get by with a little bit of cheating, you might say. But some people are very sensitive, and if you're having any kind of significant Lyme disease symptoms, or you think it might be Lyme disease, it's really critical that you get rid of these chemicals that are part of what is messing up your immune system, and that's leading to the Lyme organism becoming more of an aggressive bacteria in your body. The second person was somebody who had responded very well to the natural program, and had responded so well that this person had decided that it could be stopped. And one of the features of Lyme disease is that in many cases we don't get rid of the organism, and partly because it's probably has been living in us for many years without causing toxicity. And so it's sort of adapted to living in people, and there may not be an ability to even get rid of it completely in many patients. The issue is, can we change it to a stage where it's not so aggressive? Now, the only tool that in most situations that is employed are using antibiotics to knock it down, which that does work, but it doesn't usually completely knock it out in chronic disease. Now, in acute Lyme disease, sometimes it does knock it out. But in chronic Lyme disease, it often doesn't, and it just suppresses it for a while. And the use of antibiotics, unfortunately, causes the gut to be disturbed significantly. And the first patient I was telling you about actually has discovered that antibiotics makes him worse. The natural program makes him better. Antibiotics makes him worse. And it's probably because it's disturbing the biome so much, the gut biome. The third patient is a child who has Lyme disease, confirmed Lyme disease, with significant neurological problems, and is completely controlled with the natural program that I've just outlined to you, except when he forgets to take the herb that we use that does suppress Lyme disease growth. So we do have to use some tools to try to suppress Lyme disease growth because it has become a toxic bug in our system for people who have Lyme disease. And when this this child forgets to or doesn't take that particular herb, the symptoms start coming back almost immediately. And when he starts it up again, symptoms go away within a day or two. So the point is that there are some strategies that are non-antibiotic based. When Lyme disease comes back, one way to approach it is to use this more natural program that focuses primarily on detoxifying the body of the key chemicals that are messing up the immune system while replacing and repairing the GI tract and the biome. And there's multiple steps to doing that. It's not just taking a probiotic capsule. There's multiple steps that you need to do if you want to repair your biome, and if you want to treat Lyme disease in a way that is natural, uses natural substances, does not use an antibiotic. You want to give that a try. There's a link to our program. I encourage you to give it a try if you have it. If you think you have Lyme disease or you've got recurrent symptoms all the time, follow it to a T. All of the steps of the program are critical. You can't do 3/4 of it and expect to have an excellent response. Follow the whole program, and the chances are pretty good that you're going to feel a lot better within a few weeks. So hope you found these different stories encouraging if you're somebody that's dealing with recurrent Lyme disease, because I've seen now over a couple of years significant improvement in the majority of people that follow the program. I wouldn't call it a cure. I would call it control. So I wish you well. God bless, and have a great day.